Good afternoon, everyone. Good morning, depending on where you are joining us from. Thank you very much for taking your time to join us today for this East Africa Biodesign webinar. My name is Oemba Jean Dodier. I'm the East Africa Biodesign Program Coordinator. And I'm joined by my colleagues, Dr. Nathaniel from UJC, Dr. Ken and Anthony from Kenyatta University, Megana from the Stanford Bio Center for Biodesign, and our esteemed East Africa Biodesign 2024 fellows, Salsawit, Basil, Maureen, and Beltran, whom we will get a chance to hear from in one of our sections of this session. We're so grateful to everyone, especially our partners, whether those online or those who are not, for their continued support and collaboration. Today's session is intended to give you all a detailed overview of the East Africa Biodesign Program, answer different questions that you have, and also get to explain more on the ongoing applications for the 2025 East Africa Biodesign Fellowship. Our agenda for today will be kicked off by a presentation that will be led by our program leads for UJC and at Kenyatta University, followed by a panel discussion with the East Africa Biodesign Fellows, and that will be also followed by a Q&A section that will be a section to answer different questions that have been raised by our participants. Before I give the floor to our presenters, I would like to remind you to please make sure that you write your questions in the chat box, and we'll have them answered in the Q&A section. Without further ado, I would like to invite Dr. Nathaniel to take us through the program presentation.
Thank you very much, Oemba. Good afternoon, good morning, depending on where you're from, and welcome again. I will start by giving everyone a little bit of background on the medical device landscape in low resource settings such as ours. Healthcare systems in low resource settings are heavily reliant on imported or donated medical devices. This has negative implications as these products are not designed to efficiently serve the social, the cultural, economic, and infrastructural requirements of these populations. And thus, up to 70% of medical devices in low-income settings are found to be non-functional, meaning they are on the ground and on paper, but they're not improving healthcare access to patients. Similarly, research shows that up to 95% of pharmaceutical products are also imported in low resource settings, which poses a very similar concern. Although over recent years, there have been a boom of digital health technologies that have improved access to healthcare, there is still a massive gap in need-driven, locally appropriate devices and drugs in low resource settings. We ask ourselves why. There's many things on this list. It could be outdated or non-existent policies that make innovation not conducive. Poor intellectual property protection and regulatory frameworks increase the risk of ventures. Although funding has increased slowly over the past few years, funders still hesitate to invest in medtech in low resource settings because of the higher risk and the low returns associated. With all of this accounted, the lack of a defined pathway to ease the journey from idea to market also dissuades innovators from venturing into medtech innovation. But there is a framework which can be thought and learned by innovators. The biodesign process is a need-driven innovation framework that was developed in 2001 at Stanford University. It is based on the design thinking framework, but specifically tailored to the peculiarities and the difficulties of medtech innovation pathway. Currently, this process is officially thought and implemented in more than 10 programs across the globe, with some remarkable results in low resource settings such as India. The biodesign process is a proven and repeatable process that helps practitioners identify critical unmet healthcare needs, invent novel healthcare technologies to address them, and prepare to implement these products into patient care via an iterative process. Ken?
Sorry, Anthony, you're on mute.
So to bring the biodesign process in East Africa and to solve the problems that Nat Neil has elaborated on, a partnership has been formed between several universities in East Africa and Stanford University in the US. And the aim of this program basically is to bring a program in East Africa, which is East African Biodesign. And its main aim is to strengthen and advance health equity across the East African continent by training local innovators in the process of biodesign. This will help us to come up with local innovations that are contextually appropriate, and hopefully they will be accessible to our population and they can be sustainable in the long run. Next. So this program is being offered in 2 countries in East Africa, but it's supposed to help the whole of the African continent. So in Rwanda, the program is being offered in the University of Global Health Equity in collaboration with the University of Rwanda. Where else, next, in Kenya, this program would be hosted within the Kenyatta University in Nairobi. Next. So to make this a realization, we have a core team which has been trained in the process of training people in biodesign, and this happened in Stanford University. So we have 2 doctors who include Nathaniel in Rwanda and myself in Kenyatta University. And then we also have 2 engineers who is Gerard and Kenneth, both one based in Rwanda and the other one who is Kenneth, who will be based in Kenya. Next. Of course, this cannot be done without collaboration from our outside collaborators. And we have 3 well-renowned faculty from Stanford University. This is Ritu, Krista, and Rose, who are quite vast in the process of training people in biodesign. We also have a group of external experts and mentors who are drawn from the African continent and also from outside the African continent, and mainly from the industry, so that we can be able to enrich the whole of the biodesign process from identification of needs all the way to implementation within the industry. Next. So who are we looking for? We are looking for 8 candidates, and these candidates, 4 will be based within Kenyatta University, and the other 4 will be based within the UGHC in Rwanda. And the candidates that we are basically looking at for is people with a bachelor's degree, and it's our hope that we will be able to form teams of physicians or public health individuals, people with health informatics, engineering teams, and business graduates, so that we can be able to form good teams that can be able to take the process all the way. However, the candidates must demonstrate interest in health technology innovation. They must also be able to have exceptional leadership, problem solving, creativity, teamwork, communication skills, and also we are looking at teams that probably these candidates should come from the African continent. So the whole program will take 10 months, and it is supposed to be a full-time type of fellowship. So the fellows that will get, the 8 candidates will be based for those 10 years within the 2 universities. To be able to make this a reality, they will get a stipend, which will be able to support them with both housing and the day-to-day needs. At the same time, these candidates will be given an opportunity to attend some form of training within the university, within Stanford, and for 2 weeks. Next. So the program, basically, as I've said, it will be based in Kenya and Rwanda. So we'll have the four candidates in Kenya and 4 candidates in Rwanda, but we'll have cross-team training either in Rwanda or in Kenya. The main area of focus will be in maternal and child health for this group of candidates that will be with us for this year. And maybe with the time we may change to other different areas, but right now we concentrate on maternal and child health needs. Nat?
Thank you, Prof. Anthony. Just to reiterate, you guys should not be worried. No one is expected to come with a proposal or an already thought out concept. The process involves finding needs and developing solutions. So anyone who wants to apply doesn't need to have an already existing program that they want to develop in the program. So let me give you a bit of an overview of what the fellowship will look like. If selected, the first 4 weeks, you will have an opportunity to familiarize yourselves with the stages of the biodesign process through didactic classes and hands-on activities. Following that, you'll go into communities, health centers, and hospitals across Kenya and Rwanda to observe maternal and child healthcare service and hold interviews to identify potential gaps. After that, you go to the drawing board to validate your observations through further interviews and research. In this process, you'll also narrow down to a few need areas to take forward through the process. In the second phase of the program, you will develop solution concepts for the need that you've identified and learn to systematically test and filter them out. Consequently, you'll take a carefully selected concepts through further prototyping and development. In the third phase of the program, you'll start to discuss what it takes to take a product to market and have true impact. You'll design your business, regulatory, and intellectual property strategies, and try to account for all necessary steps to take towards impact through your operation plan. Finally, you will have the opportunity to join companies for a 5-week externship to apply the skills that you had learned so far and learn more about how the industry functions. So where do you go from the fellowship? Fellows can launch healthcare startups. This can be startups for their projects during the fellowship, or ideas and needs they have found after the program. Fellows can also drive innovation inside major health tech companies or join advisory organizations and incubators to help drive innovation within these spaces. Some fellows who want to go into academia can also teach innovation within academia and produce more innovators for the continent. Thank you very much. Over to you, Oemba.
Thank you, Dr. Nathaniel and Dr. Anthony, for the presentation. And up next, we're going straight to the panel discussion. We'll be having an open conversation with our fellows, and our fellows will be sharing their experience and journey so far in the East Africa Biodesign Program, and a day in life of an EAB fellow, and what a prospective applicant should look out for from the start of the application and to being accepted into the program. So allow me to start with Salsa. Salsa, what is your experience of the EAB program so far?
Thank you so much for the opportunity. In my opinion, the program has been immensely impressive and very much up to my expectations. Because if you're looking for solving any overwhelming medical or healthcare challenges in a setup like ours, it's probably smart to look for like an important tool like a process. And this program has provided that in very efficiently for me, in my opinion. Like with my experience from working in my background, like as a medical doctor or practicing in a primary level hospital or versus tertiary level hospital, sometimes the problems is not just a lack of medical devices or like expertise or even the clinicians being adaptive to the devices. Sometimes it's just all of them sitting together on a table and figuring out a solution that works best for them and customizing a solution. And through this process, it was possible for me to have problems and solutions filtered out, to have them put on the ground in a very much less, in decreasing the likelihood of like failure through the process. So yeah, thank you.
Thank you for sharing. Just a follow-up, looking back into time before you joined the program, would you say the East Africa Biodesign program met your expectations? What would you say about that?
I think very much so, yes. My expectations have been completely met in regards to like having a step forward or like where to start next, because healthcare challenges are usually very complex and it could be very overwhelming to fix them or like to want to fix them and not having a way. So this process has been very much of a helpful tool for me to pursue in the future as well. So yes, it's completely, yeah.
All right, thank you very much. So as you know, we have many participants who have joined us today, and many of them are interested in the program, or some of them have already applied, or some of them are looking forward to apply. And I would like to ask Maureen, what advice would you give to the people who want to join the program?
Okay, thank you, Amber. So for me, let me start with the application process. There are several reasons for you to join East Africa Biodesign Fellowship, but most important is your authentic passion for medtech innovation, specifically for our setting, that's Rwanda, Kenya, and Africa as a whole. So if you have this authentic passion, this is what will keep you, or this is what will drive you throughout the whole process, because it's more of practical, not just like an academic paper. So yeah, if you have this authentic passion and you're applying, just know, like throughout the whole 10.5 months, you really enjoy this program, because in the end, you just have to enjoy the program. And should you make it like into the program, come with an open mind. Open mindset is very important for the fellowship, in a way that it's all about you learning, unlearning, relearning. This is what we have also learned as the current fellows. Be honest to yourself and your team members. They have mentioned it's teamwork. So be flexible to work in a team throughout. And also bring your energy. Your team needs your energy. As I've said, it's teamwork. Yeah. And also the other thing, you have to be aware of yourself, know your personal strength, and as well as weaknesses. If you're not sure about yourself, be ready and willing to learn through the process, to discover yourself. It's also a place where you are actually growing. Lastly, this is what I can add. It's all about mentorship. So be flexible to be mentored. Know how to synthesize mentorship feedback, because this is like a catalyst for the whole program. Yeah, so that's what I can say. Thank you.
Thank you very much for sharing that. That was a very good explanation of what somebody who's looking forward to apply should expect, and more will be discussed as we continue to answer different questions. Basil, I want to apply for the program, but I did engineering and some other different courses, and my colleagues as well who are interested have different backgrounds. Would you say the EAB program is more suitable for certain types of background, or would you recommend anybody to join?
Thank you, Amber. The East Africa Biodesign is open to certain category of qualifications. It cuts across engineering, it cuts across business, it cuts across technology and healthcare, those practicing medicine, nursing. But I think beyond these qualifications, the critical thing for someone who wants to apply is, do you have the desire? Do you have the interest in innovation? Because I believe the first product of this fellowship is the innovator. And so you must have a certain interest in innovation that the program is going to build upon, and then makes you a better innovator. And the secondly is a little experience, right? Someone who has been in industry for some while, has done a few things here and there, especially in innovation, in healthcare, then the program will build upon that little experience and make you a better innovator. Thank you.
Thank you so much. So for those that are wondering whether their backgrounds qualify them to apply to the program, Basil has rightly put it in a better way. So you're very welcome, and we are very much looking forward to receiving your applications. Beltran, I have been accepted into the EAB program, and I'm just wondering, what does a day look like for an EAB fellow?
Thank you, Owemba. Day to day of this program depends on which phase you are in. So we start with the identify phase. In identify phase, after doing clinical observation, you spend like 50% of your time will be doing research, trying to validate the needs that you found from the observation. And then after that, you spend like 30% of your time meeting with the team, sharing what you have found from research, and deciding which need to move on and which needs to pack. Then after the 20% of the time remaining is allocated for meeting with mentors. We have both clinical mentors and technical mentors. For clinical mentors, we help you in validating the needs, and technical mentors will actually help in understanding the business stuff behind the needs that you have found. Then when you go to invent phase, now the time shift, like you spend 50% of your time doing developing the concept and doing a research about those concepts, and also doing the prototype as you go on, as you move on. Then the rest of the time you'll be meeting with clinical mentors, trying to actually ask them if the solution that you are bringing is going to make a difference. And also you'll be asking people outside the fellowship. You can approach people from, let's talk about mainly Rwanda in context. We can approach Rwanda Biomedical Center to ask them, if we bring this solution to the market, are you going to buy this type of the product? So basically that's what we do. Thank you.
All right. Thank you very much for sharing. And let us go back to our experiences in this fellowship. Maureen, as an EAB fellow, could you share some of the challenges that an EAB fellow should expect to face, or the ones you might have faced? And what are the potential ways to overcome those challenges?
Okay, thank you, Oyemba. Yeah, so as I said, this is teamwork. One of the things has been like, I wouldn't say it's necessarily like a major challenge, but it's something that you get to learn through the process. I am a biomedical engineer by profession, and then I'm working with doctors. So actually, coming together, like the very first days, to me felt like was hard actually. And then as a team, when you discuss things for you to move forward, that was actually reaching like a consensus. That's what I mean. But we have mentors, the leadership mentors, teamwork mentors. They train us and they also give us advice on how, as a team, we can move forward. And the other thing has been like me as a person accepting this is like an iterative process. It's not like a linear thing. It's a process that you go forward, you come back, but in the end, you still make progress. Yeah, so accepting it took me time. Sometimes as an engineer, we are straightforward. We are just thinking straight, okay? Just like equations. I hope engineers in the room understand. Yeah, so through this process, the best part is mentorship. You have a place where you can talk to your mentors, the challenges that you're meeting, like in these are like soft challenges, but then your mentors actually enlighten you on how a team you can come together. We have like a team charter thing where as a team you set up your, I should say your goals. You try to explain to one another your strength, your weaknesses, the things that you are expecting in the program. So you're always going back like to your team charter to check if you are in line, yeah, for the sake of progress. So yeah, challenges are there, but then we have people supporting us. Yeah, maybe the other fellows can add. Sure.
All right, thank you very much. I just want to pose this to somebody from medical background. Salsa, would you say, how has it been coping up with engineering concepts? How is it as a medical doctor working on a group with engineers? How do you manage that?
I don't know. For me, it's been fun, honestly. Like it's been a lot of learning experience, and it's been a lot of perspective changing each time. Like there's always this fixation in med school, like this is the way you're supposed to do it. But then in this program, like working with my team, I've always questioned like, oh, why? Like we've always done something like this, but then we've never actually sat back and said, oh, why do we even do that? So that was the opportunity I got, especially like working with this team. It has been a lot of interesting questions and interesting answers, and like the whole journey of answering those questions too. So it was fun for me.
All right. Thank you very much. It was thank you very much for sharing your experiences, the lesson learned in your journey and the journey ahead as well. And we would like to call that the end of the panel discussion. But up next, we have an exciting session where we dive deep into different questions that have been raised by our participants. And I would like to start with Dr. Nathaniel. One of the applicants is not East African. Do they stand a chance to be selected into the program?
Thank you, Emba. Absolutely. I think we have one of our fellows, Maureen, is from Malawi, which is not an East African country. We do encourage East African citizens to apply as an East African biodesign program, and also easier for logistics. But that shouldn't stop anyone from applying, as long as you're an African citizen and have a strong command of English. We are happy to accept your applications.
Thank you very much. We have one of the questions that was raised about areas of interest. I think Dr. Anthony mentioned that currently the program is focusing on maternal and child healthcare. And one of the applicants would like to know, Dr. Anthony, when do they know what to focus on? When are the fellows exposed in areas they should be focusing on during their program?
Yeah, thank you. I think this is a very important question. So what will happen is that once the fellows are admitted into the program, they will have an induction process where they will be taken through the biodesign, like in a rapid way of a very short time frame, and they will be given set problems, which we call vignettes, so that they can be able to sort to see how the whole process from end to end works over a certain time. During that same time, they will be introduced to various maternal child health issues, the process, the physiology, a bit of the anatomy, a bit of the health systems, in as far as the maternal child space is concerned in our context. Then after that, they will be given a chance to for some clinical immersion, where they will be allowed to observe the delivery of healthcare within the maternal and child health in various hospitals within Rwanda and also within Kenya. So that they can be able to look at the various needs that come out from this type of clinical immersion. So the fellows at this time will have to look at what are the pain points, what are the constraints that are there, what are the needs that are there within the maternal child health delivery within in our healthcare systems. Then they will come up with several needs, and they will use some criteria so that the various needs will compete with each other. And then they can be able to come at the end of the day with the top needs, maybe 10 needs out of the many, many needs that they will be able to come up from observing the various problems within the maternal health space in the hospitals that they will rotate in. Thank you.
Thank you very much. Megna, as an applicant, I am stuck. I do not know whether I should go to Kenya, whether I should go to Rwanda in UJC. When do I get a chance to choose where I want to go?
Yeah, so this is going to be part of your application process. When you're applying, you will select if you're applying only for our Kenya program or for the Rwanda program or for both. So I would seriously consider when you're applying whether you'd be willing to relocate or the logistics of participating in a full-time fellowship, and then decide if you're down for either program or if one makes more sense for you. And we'll consider you just for the programs that you select.
All right, thank you. Thank you so much. Dr. Kenneth, for the fellows, during their fellowship duration, the solutions they are expected to come up with, do they have to be medical or it can just be a technological solution?
So maybe Kenneth may be, I'm not very sure whether he's in the webinar, but maybe I can answer that. So what the solution can be either medical or technological, as long as it comes from the needs that the fellows have identified in the relevant area. And this time we are saying the needs that they will come up with from the maternal and child health space. So they can come up with any solution as long as it is a solution that is going to solve a need that they came up with when they underwent the observations within the clinical area in that relevant field. So what we are looking for is a need-driven sort of solution that will solve the problems that they observed within the space that they will observe the delivery of care in. And this time is in maternal health, maternal and child health space. Thank you.
All right, thank you very much. Dr. Nathaniel, as an applicant, is there any age limit? Can I apply if I'm 30 years old, 20 years old, 40 years old?
No, we don't have any age limits to the applications. Anyone who's interested in innovation for health and anyone who has the correct backgrounds that we've listed earlier in the presentation is welcome to apply.
All right, thank you. And still, again, back to you. As a fellow, does the program support me in terms of coming up with prototypes?
Yes. So as Dr. Anthony mentioned earlier, you'll find needs, and the second phase of this program is to come up with solutions, to prototype them and systematically test and filter them. Throughout this process, you will have support from our engineering faculty and faculty from external faculties from industry that are experts in prototyping and developing products in other spaces as well. So the entire process will be guided by core faculty, which is us here in this panel, as well as experts in industry that are doing these in the real world, I would say. So there is a lot of guidance and support in all phases, including prototyping.
All right. And before we leave that point, I know you've touched a bit on that, but can you also tell us if the fellowship has prepares me as a fellow in terms of knowing what the regulatory pathways would be if I decide to come up with a certain solution?
Yes. So going from prototyping and doing the engineering work of the biodesign process, the third phase includes implementation planning. Implementation planning can be learning about regulatory pathways that are possible to take within the African context, learning about intellectual property approaches and how to go around them. This includes filing IP and searching for IP. Both of these will be guided by experts in intellectual property, so intellectual property lawyers and regulatory bodies from Rwanda, Kenya, and also if needed in particular cases from the US or Europe as well. So the last phase of this program involves the way to go to market, including operation plans, regulation, and all of that, which, as I said earlier, would also be guided by experts.
All right, thank you very much. Megana, as a fellow who has a business-oriented mindset and the courage to develop something, is the fellow, can the fellow build a company out of the fellowship from the solutions they develop?
Yes, it's definitely possible to build a company. So the biodesign process is intended to train you in a process that you can use over and over throughout your career, not just one time in this fellowship, but a repeatable process for healthcare innovation. That being said, this originated out of Stanford Biodesign, which has now generated 57 companies directly out of our training program, and even more from our alumni. And we have a number of global partners all over the world, similar programs such as in India and other settings in which we've also had a number of very successful companies launched out of these programs. So part of why we wanted to get involved in starting East Africa Biodesign is we thought we had a really strong process that we could repeat in other contexts that would guarantee that you have better odds, at least, of launching a successful company and really anticipating both the opportunities and the challenges in healthcare innovation.
Thank you very much. Dr. Anthony, I know the fellows have talked about going into clinical immersions, doing the needs identification, But as a recently selected fellow, I have been exposed to different fields, and I've at some point done some of the needs assessment myself. And before joining the program, I come with my own identified needs at some point. Does the fellowship provide that room for me to focus on my needs, or I have to strictly start over the process, as rightly said by the fellows?
Thank you. But remember the fellowship that the biodesign process, one of the cornerstones of the biodesign process is need identification and also teamwork. So in the process that in the fellowship, what we would want to do is to have a team that will be able to go into clinical immersion, leave all the biases away that you have. I mean, I may have been like, maybe I'm an obstetrician or I'm a medical officer or I'm maybe a nurse who has worked in the maternal child health space forever. Of course, there are many biases and there are many things that we think are problems. But when you look them with the lens of a team, where you have people from engineering, people from business, you find that you are able to enrich the problem area, and you're also able to come up with the needs that can be can have an impact if you are able to come up with a solution. So in this fellowship, we are not encouraging people to come up with their own needs. So we'll start with a clean slate so that a team can be able to identify their own needs and then come up with a solution at the end of the day. Thank you.
Thank you so much. Thank you so much for answering the questions. I think we're getting close to the end of the session, but one last question we have for Dr. Nathaniel. As an EAB fellow that just graduated from the program, what's next? What support do I get from the EAB program post the fellowship? Or do we part ways? Is that the end between me and the program?
Thank you, Emba. Good question. So the program offers the biodesign process as a skill set that can be repeated and used in future life. But also, we're trying to build a community of innovators for health tech within the region. We're currently building an ecosystem of players such as regulation, IP, as I said, incubators and accelerators who can scaffold this biodesign process and be the next steps for our fellows. So even after the fellowship ends, fellows will have access to all the networks and the ecosystems that East Africa Biodesign has been building for the past couple of years. They will have access to mentors and to any guidance that they would require in their future careers. If the fellows, I'm going to answer another question that's in the chat room that I just saw as well. If the fellows do come up with a project that is viable in market and we deem it to be a potential solution to the gap identified, the biodesign process the program will fund fellows on a seed grant to continue working on their project over the next year and feed them into incubators that we have already established relationships with to continue to grow their products. So the relationship by no means ends at the end of the 10 months. I would say it just started. Thank you.
All right, thank you. We just got one quick one, and Meghana, can you, as a fellow, can you tell me, like, who are these people training me? What are their backgrounds? Are they just doctors, engineers? Are they both?
We have a very wide range of amazing faculty, including the people here on our panel, as well as our folks at Stanford. And I would say that they come largely from successful healthcare innovation backgrounds, and that can be folks who are trained as clinicians, trained as engineers, trained as venture capital consultants, or trained in any capacity of impacting the healthcare innovation system. But the thing they have in common is that they have been working on healthcare innovation, on healthcare needs and solutions for a long time and really understand that process. So there are folks that will touch at every stage of that process, whether that's folks who are really incredible at needs finding and observation, or at prototyping and hands-on support for prototyping, all the way down to when you get to intellectual property and regulatory expertise. There are experts of basically every kind. And as mentioned before by some of our fellows, there are folks who specialize in team dynamics and coaching and working through the process. So you will interact with an enormous range of people who bring a wide variety of expertise, but who are all centered in their careers around healthcare innovation and making an impact for patients.
All right. Thanks, Meghana. I hope that clarifies the curiosity, those who are asking, like, who are these people that I'm going to interact with for the next 10 months? And yeah, thank you so much for that. And that brings us to the end of our sessions, the end of our webinar today. We thank you, everyone, for taking your time to join us for this conversation. And we are very much looking forward to receiving your applications. And one more time, we express our deepest gratitude to our partners for their continued support and collaboration to make this program possible. And in the chat, we've put the link to our landing page. It has our email address. Feel free to reach out to us. Feel free to contact us. Even if you're not an applicant, we welcome different types of collaborations, and we're very much to engage and talk about different areas that we can collaborate. So thank you very much, everyone. Have a great evening. Have a great morning from wherever you're calling in, and bye. Thank you.
Thank
Thank you,
you.
Amber.
Thanks, everyone.
Bye, everyone.